Welcome, everybody, to World Heart Day. I am Ronney Shantouf. I am the director of the Cardiac Catheterization Lab at Cleveland Clinic in Abu Dhabi. And I have a very special guest today, my co-director of the Complex Coronary Care Interventions Program and Microvascular and Spasm Program, Dr. Ashraf Al Azzoni. And today we're really going to talk about complex care and innovation, and what does that mean to us, and what does that mean to our audience, especially in this special day of World Heart Day.
Thank you so much. My name is Ashraf Al Azzoni. I'm an interventional cardiologist here at Cleveland Clinic, Abu Dhabi. I did my training in McMaster University in Canada and worked in Toronto for several years before joining the amazing group here at Cleveland Clinic, Abu Dhabi. Today we'll talk about several aspects of cardiology, mainly focusing on innovations and newer techniques and newer interventions that are available in the field of cardiology and specifically in interventional cardiology aspect of it.
Dr. Ashraf, when you hear the phrase complex coronary care, what does that mean to you? What does that mean to our audience?
So it means to me having a program that is designed to take care of all of the needs of the patient. So sometimes the interventions we talk about are easy, simple, but many times they are advanced and complicated. It means to me having all the equipment and the expertise for us as physicians there to be ready to serve our patients and give them the best outcomes possible. It means providing patients with the safest, most straightforward procedures they can get anywhere in the world. It means having several layers to the program between physicians, between nurses, between quality teams monitoring all the quality indicators, having this program designed to provide the best care to the patients possible.
And I think that's a great, introduction to really where we want to go today and kind of have a discussion. And, heart disease is really still the number one killer, right? I mean, it is still the largest disease burden that we have to face globally and specifically in the UAE. And as part of that, we have a lot of patients to take care of. And there's a whole conversation that can be had about prevention. There's a whole conversation about routine care. But I think let's focus a little bit on when things get a little bit more complex and when patients should seek out, potentially care in a what we call usually a tertiary or a quaternary care center. And really, where are we going? What's the innovation? What's the technology? What do we expect in the future? What's coming for the future for all of us, for our patients, for our family members? And so just knowing that, so let's take, for example, a patient who is found to have blockages in their arteries, and they're going to need it to be fixed, whether it's by stenting or by surgery. And so how do we approach it, for example, at Cleveland Clinic in Abu Dhabi?
Yeah, so the good thing that we designed and worked over here in Cleveland Clinic Abu Dhabi over the years is we designed clinics specifically tailored to address such patients, to help them from point A when they come to the hospital to see the physician, then throughout their journey, having the procedure, the follow-up and all of that. What gets me excited about it is that here in Cleveland Clinic Abu Dhabi, we also designed it in a way where we have all kinds of equipments we need in the cath lab for any intervention we need to do. We have all the expertise. The nice thing we also do, as Dr. Ronney, for the advanced complicated cases where we do as two separate teams together. Each team is able to do the procedure on their own, but we do it together, combined with everyone in the room, so that we give patients the best safety profile possible. And we also designed it because this way, so that we are available to help the community here in UAE. So whenever there is any complicated case from anywhere else in the country that comes, we are ready, our doors are open, they just transfer them, we take care of their needs, we give them the best care possible. And this was not going to be possible without having such infrastructure, without having such manpower, without having a team-based approach to provide the best quality care to our patients. But maybe I just want to take it a step back and ask you, Dr. Ronney, about the innovations in the field. I feel excited because it seems to me in the last several years, several things advanced in the field of cardiology, several even medications, several interventions that are now available to our patients that can help our patients. I don't know if you can summarize it to the audience. What were the major changes or advances in the field you noticed in the last several years?
Yeah, that's a great question. I mean, I think we're lucky that first to be at an institution and really in a country that has access to innovation and technology. And that is not always true. And there's a lot of our colleagues that practice in environments that become a little bit more strained. And we're lucky that we are in a system that believes in providing the best care. And so for example, I mean, if we even start with prevention, we are at a place now where we have multiple options when it comes to, for example, cholesterol-lowering medications or lipid-lowering medications, where really even 5-6 years ago, the access to some of these newer medicines that are, for example, injectable medications that are able to help lower your cholesterol on top of oral medications or pills that you would have to take that really will help patients that have had really, really abnormal cholesterol or very high, give them the opportunity to be treated and reduce their risk. That is an option that we have here in the UAE. That is not true in every single parts of the world. When we talk about interventions or we talk about the things that we do, and like you said, when there's a complex case, a lot of times we'll do it together. You and I will scrub in, do the case together, give really the patients the best opportunity. We sort of tackle it as a team-based approach. I think, our equipment options when it comes to, let's say, things like what we call chronic total occlusions or CTOs, where the artery has been closed for a very long time, and the ability to open it is not as straightforward in a routine blockage. And these are cases that might take 2, 3, 4 hours. And we have equipment that allows us to not only try to open the artery from the front, but also maybe from the back to approach it from the other sides of the arteries and come from reverse. When we move into spaces such as blood pressure management is typically been limited to the realm of medications. And now we have actual potential options where that we can go in with catheters towards the arteries of the kidneys. And it turns out that we've learned through decades and decades of research and science that the kidneys and the blood pressure have a very strong regulated network that help to manage the blood pressure. And there are balloon or catheter-based technologies now available to help lower the blood pressure. And these are options that we do have here at our hospital for patients. Patients that have severe chest pain and angina, so we call angina, that maybe have no options for fixing. So there's no surgical option. There's no stenting option anymore. There are new technologies for equipment called sinus reducers. So these are essentially equipment where we can actually implant something on the venous side of the heart, and that can help to reduce the pressure load or the chest pain load for patients. And so really, there's a lot of exciting things coming. I think with the field of, this is just the technology and the innovation, there's a lot of new, non-invasive ways to start to measure blockages in the arteries, where we can use pictures and the CT scans to help us figure out if patients' blockages need to be fixed or don't need to be fixed. And so the science is really changing, and that's also part of the spaces. How do we, and what is the advice that you would give or give yourself with all this technology? We also don't want to end up in a place where we just using it and we're not understanding it. And so really, to me, that sort of brings up the question of quality and how do we handle that? And, what's your thoughts in regards to, with all this technology, what is the best way for a hospital or a healthcare system or the cardiology department to handle such things?
Yeah, so two aspects to it is, number one, to make sure you address the needs of the population. For example, you and I, several years ago, developed this program about what we call microvascular and spasm assessment, essentially to look into the needs of such patients who has had a coronary artery angiogram several times before because of recurrent chest pain, and they're still suffering and nobody gave them an answer. So we went into how we actually check for all of these small arteries in the heart and for the possibility of spasming, contracting in the coronary arteries of the heart, to look into why is the pain happening and so on, and then find them solutions. So to make sure to listen to the needs needs of the population, while at the same time monitoring all the quality metrics and all the quality aspects of the program. And that is something we do very thoroughly here at Cleveland Clinic for all the cases that come whether to the clinic, whether come to the inpatient floor, or even the ones we do procedures for, where we monitor them before, during, and after. And then we compare our numbers with worldwide based databases that are available to us to compare with, and we actually enroll our numbers into the US based databases and so on, so that we compare our numbers with the best centers in the world, and we make sure we are always on top and we are always ahead of everyone else and doing things the best way, safest way for our community here in UAE. This brings me to a question when I think about the World Heart Day is for patients and for patients who did not yet develop or not aware of coronary artery disease and so on. What should their take-home message be? How can they use this like a point in time to change the course of their health in general, life-wise?
Yeah, well, this is really important, right? So because everybody is at a different stage or phase in their life. Some people have no blockages, have no coronary disease, and they're really trying to figure out how to prevent the development of coronary disease. There are a lot of people who have already had a heart attack, and they're trying to figure out, is there a way to prevent a second one or a third one? And the good news is everything we do, the medications that we provide, some of the procedures and surgical routes that we provide, all will help to reduce that risk. And even probably most important is what the person does for themselves. So whether it's approaching life and eating healthy and really focusing on whole foods, for example, is a basic approach, real food, as one aspect of being healthy. A second aspect is exercise and making sure they really sort of incorporate physical activity in their life, because there's a lot of data on this, not just for prevention, but after somebody has had a problem. So after somebody has had, let's say, open heart surgery, or they have had stents, or even if their heart pump is weak, there are a lot of therapies we have a lot of therapies that help, but these are all core basics. Making sure your blood pressure is under control, making sure your blood sugars are under control, and you either reduce the chance you have diabetes or help to reduce the you know, how to what level of diabetes you have. Smoking, you know, smoking cessation, so really removing that from your risk. Weight management. These are all things that we know that all tie in, and a lot of times I think of them as they're sort of pillars to a house, and you got to work on all of them if you want the house to stay afloat. If you just knock down one pillar, you might lose the whole system. And so, or focus only on one and not another, you might run into trouble. So really, prevention is still, no matter what, we should always be working towards preventing. A lot of the medications we provide help to mitigate those risks and reduce those risks, and they're very important, especially when things have already started. What about, let me ask you, really advanced care? When we start to kind of push things, when things are really complicated, when the heart pump is not working, you know, where are we? You know, there are options that we are lucky to have here, right? Things like LVADs and pump supports to help, and even heart transplants, and this is something really unique to the environment that we have these options here. Where does that all fit in? You know. Do you expect this to be at every hospital and every center, or is this on purpose, or is this really make sense that we're in this is sort of limited to select hospitals in the region?
Yeah, so first of all, where it fits. So I really see cardiac care as a spectrum. So on one end, as you mentioned, there's prevention. We want to prevent this actually from happening. On the other end is when cases are so advanced and the heart failed as a pump, and we look into advanced therapy like whether it is a pump, whether it is even heart transplantation and so on. And in the middle there are all the different kinds of heart disease that are there, that are already there established, but we work on controlling it with medications, many times even needing to add a stent here or there, fix the blood flow to the heart, the structural team fix a valve and so on, to keep the heart going for as long as possible, to try to delay that possibility of the heart failing down the road. So the amazing thing about our cardiology team here in Cleveland Clinic Abu Dhabi is that we have it, honestly I see it as we have the whole spectrum, so we are like ready to deal with the whole spectrum of this of heart disease, from prevention all the way to the end of it. Regarding the second aspect of the question is about if certain centers or certain places should be doing this. When it comes to such advanced therapy, when you talk about heart transplant, you talk about pump and so on, it really, in my mind, has to be done in like a very, very advanced center that is not just able to do the procedure itself, is also able to take care of the patient before and afterward, and maintain and also troubleshoot any problem that the patient will go into. And usually when you like specify a certain center for generally, for example, the country or the emirate and so on, then you build up the volume in that center to allow everyone to do the maximum number of procedures they need to do to continue to have the best skills in that field. So I think we are in a way positioned in a good way within UAE, where we are getting all of the patients who need such advanced therapy, and we are treating them, giving them all the therapy they need. And then also we transition back to the referring centers for the ongoing care afterwards, when we manage to stabilize the situation and take them out of the immediate life danger zone, and then take them back into a more stable situation. Then we co-manage such patients with our colleagues in the community. Maybe one more question from my side is it ever too late for a patient to be assessed, to come to see a heart physician? Is it ever too late? When do you think is the right time for patients to be checked and to be to look more into their heart health overall?
Yeah, I mean, the short answer, it's never too late. There's always something that we can do. But there are scenarios where once things have happened, we can't reverse certain aspects. So, for example, once somebody has had a heart attack, things change, right? They're not exactly the same as they were before. We can, really technology is at a point where we can a lot of times make things nearly as good as where they were. But this is really where getting evaluated early, screening, if you have a strong family history, if you have multiple risk factors, not waiting too long to get evaluated, so that we really try to prevent these things. But there's a lot we can do at every stage. I mean, the fact that we're at the stage in a society where we can actually do a transplant, but those things are not necessarily for everybody. Right? I mean, there are certain ages, you hit a certain age where doing something like a transplant is not an option. And so there are, while the bigger picture is it's never too late, you can always improve your heart health, there are sometimes crossroads and points that once the person has crossed that point, treatment options can be limited. And they can change. And, even options that we would provide for patients a lot of times depends on how old they are, what other medical conditions they have going on, how are their kidneys, how are their lungs. And so a lot of that plays into it. And this is really where, when things get complicated, having a multidisciplinary approach becomes very important, because we're really looking at all aspects of care and what is the right approach for patients. And I think that's one of the unique things, and one of the special things I think about being at a academic quaternary center is where we really have specialties in multiple divisions and departments that we can call on to really help us, and we can make really appropriate team decisions. In summarizing, and you and I can chat about cardiac things and forever, but in summarizing, what would you want to say or summarize on this day? And hopefully, for me, I think at least we had an opportunity to talk a little bit about how care can be complex and ways to approach it, and also a little bit about the innovative space that's coming. And there's a lot more. There's a lot we didn't talk about, whether it's structural procedures for the valves, procedures for patients that have arrhythmias. So there's a lot out there. And that's the other thing about being in a complex center, is that we all subspecialize. So you and I subspecialize in the arteries and really focus in on the arteries themselves. We have a whole team that focuses on the electrical system. We have a team that focuses in on the valves and on the heart pump. And so, in closing, what would you want to summarize, I guess, for our audience and our patients in regards to World Heart Day?
Yeah, so I like the phrase you used a few minutes earlier, is never too late. And the field of cardiology is so advanced that honestly, like if you catch any of the heart conditions at any stage, there is almost always something we can do to correct things, to make patients feel better and inshallah live longer and so on. So my advice is to use this opportunity wherever you are on that spectrum to take care of your heart health. Use that opportunity. Come see your physicians, let them do the initial checkup, see how's the heart health, how's the cholesterol, how's the blood pressure, how's the diabetes, and let them work on making sure that you live a healthy, happy life, inshallah.
So with that, I don't think I could have said it any better. And so, Dr. Ashraf, I'd like to thank you for sitting down with me today, and we will conclude the World Heart Day. I'm Dr. Ronney Shantouf, and with my guest, Dr. Ashraf Al Azzoni, and hope everybody has a wonderful day.
Thank you so much.
Thank you.